So now from here, we're going to transition into the knee. I want to talk really quick on some common pain locations when it comes to the knee, as well as maybe some other considerations that we need to think of outside of just the knee itself. So some common areas that you'll experience knee pain, right in the front of the knee, oftentimes is either the patellar tendon is getting overstressed for some reason. There's some additional tissue underneath that might get irritated depending on friction points and alignment. You have connective tissue along the inside of the knee and the outside of the knee. Those can get stressed out depending on someone's orientation and alignment. You have areas on the back side of the knee, things that can rise up, such as a Baker's cyst or maybe a little bit of some meniscus irritation. Those things will present themselves more on the back of the knee, or like a hamstring tendonitis or something like that will present itself on the back of the knee. So depending on what's going on, but those are kind of a couple key areas as far as front of the knee, back of the knee, a little bit more inside and outside. Oftentimes you'll see where the knee is the one that's screaming at you, saying that there's something wrong, but it's not the one that's dysfunctional. Oftentimes you're going to find something either below and or above that is contributing to abnormal wear and tear and stress at the knee and the surrounding tissues. So those being the foot and the hips. We've talked about the foot in prior videos, so let's go ahead and refresh really quickly. So common compensation patterns that we tend to see with people is they like to widen their base of support and excessively toe out. Sometimes you'll see it other directions, but more often than not, these are the compensations that you'll tend to see because of limitations and range of motion elsewhere, lacking strength elsewhere in the foot and the leg. Maybe they have some back pain going on, so they kind of alter the way that they're walking and moving because they're avoiding back pain. Nonetheless, those compensations that you start to see downstairs start to impact what's going on at the knee. So for example, if I take my foot and I start to toe it out, but yet I'm walking on that foot that way, I have now oriented my knee into more of a valgus and internally rotated position. So oftentimes I'll start to see people where they have maybe more of a medial or inside patellar tendon stress, medial connective tissue irritation. Their kneecap feels like it's popping or grinding often because it's not tracking really well. Um, so whether it be just purely an alignment issue, a strength issue, maybe they're not moving well through their ankle, so they need to compensate by toeing out. Those are usually going to show themselves as excessive stretching irritations to connective tissue on the knee, along the inside of the knee, as well as sometimes more of like a compression, grinding stress along the outside of the knee. Then you start to then compound that with, if they're already compensating there with their rotation or their positioning, that's going to also change how their hip is interacting, and the strength and stability of that. So that toeing out or wider base of support doesn't require as much glute activation and control. So as we're normally stepping forward, that pelvis is going to kind of rotate and glide just a little bit. And the muscles around the hip have to be able to control that little bit of sway that happens, that little bit of rotation that happens. But if we toe out, we now take those things away, and those muscles aren't doing what they're supposed to be doing for stability, and they start to weaken over time. So then that continues to now compound the issue of the hip doesn't control the leg bones as well. And so then those start to kind of compound our stress into the knee as we're walking. Again, kind of more of like an overstretch irritation and maybe an overcompression irritation on the outside of the knee. So we got to think about, if our knee is yelling at us and we weren't, um, you know, hit by something, we didn't slip and fall or something like that. Oftentimes the knee is going to be yelling at us, but it's because of dysfunction elsewhere. We got to look down into the foot and the ankle to see what's going on, as well as up into the hip to see how our motion is and what our strength is like there. Okay, And then once we start to work on those alignment issues and kind of work on correcting the mechanics and the alignment, just like we talked about with the foot already, oftentimes that by itself is going to do a lot for what's going on at our knee. So once we correct the alignment and start working on better mechanics, now what we can do is go ahead and start working on addressing some knee range of motion. So then we can start vascularizing that tissue, lubricating the joint space, and making sure that we're getting good congruent fluid motion through that joint. So we're going to look at a couple range of motion strategies next.